Okay, so this is the first rib. First thing, you have to sight it. It's difficult to do, but if you place it this way, you can see it curves upwards. Whereas if you place it this way, it's flat. And that is the right one. So this is the right first rib. It has its various parts: the head, the neck, the body, which has an external and internal surface, and then its shaft and medial aspect. The head articulates with T1. The neck then contains the sympathetic trunk that lies in contact with the anterior border, and the C8 and T1, that's superior inferior border. This is the posterior tubercle, and this is the posterior-most point on the external convex surface. This articulates with the transverse process of T1. The body has an external and internal surface, and quickly you have to locate the anterior tubercle, because this is where the scalene tubercle attaches. Sorry, the anterior scalene muscle attaches to the scalene tubercle. And anterior to here is a subclavian vein. Posterior is the groove for the artery. And between the scalene and this anterior and medius come out the brachial plexus. And it's important because this is the roots, and the trunks come out, and they then go into the posterior triangle. The anterior scalene tubercle and the anterior scalene muscle is also important because it divides the branches of the subclavian artery. Proximal, there are usually 3: the vertebral, internal thoracic, and the thiocervical trunk. And then behind it can be the costocervical trunk, which has a superficial and a deep component, and either behind it or distal is a dorsal scapular artery that comes off. Sometimes that dorsal scapular artery can come off the thiocervical, which is important to know. What's important is the groove for the subclavian artery only touches the outer border of the rib, and as it then leaves the outer border of the rib, it becomes the axillary artery until it reaches the outer lateral border of teres major and then becomes the brachial artery. The shaft is the medial most anterior end and articulates with the first costal cartilage. Important muscles that attach onto this, if we go back, are the external internal intercostals, the serratus anterior muscle, and anterior is the subclavius that then forms an attachment with the clavicle. On the internal surface, I've already said there's the anterior scalene. Scalenus medius can also be attached here, and sometimes